Hi everybody, I hope you're well. My name is Georgie Randall and I am the Client Relations Manager at Samara. Thank you for joining today. And today we're going to be talking about CQC, getting your practice compliant, the new strategy that CQC has introduced, and also maintaining compliance as well. So we'll get straight into that. I will share my screen for you. Okay, lovely. Right, so today we're going to be talking about all things CQC and compliance. So how to set up compliance within your dental practice, as I mentioned, the new CQC strategies, and also top tips on how to maintain compliance and being CQC ready at all times. So first and foremost, just a little bit about myself. So I am the Client Relations Manager for Samara Business Advisors. I've got over 10 years experience in the dental sector. I've worked both in NHS and private. I've done practice management, and that was before I then moved on to CQC compliance consultancy. And my role now at Samara is helping dentists set up brand new practices. Okay, so all things compliance. Now, it's a very sort of stressful subject and stressful topic for a lot of practices, whether you are a brand new squat practice or if you are an existing practice as well. But my advice to anybody, having been out to so many practices nationwide, is always get help from a compliance advisory service. So make sure you reach out. It's always useful just to have somebody or a company or a service who is able to implement your compliance, first of all, within your practice. So that would be implementation and help with your policies, procedures, giving you access to templates. So that could be for audits, risk assessments. It could be for sort of in-house risk assessments if needed. They'll also be able to guide you and help you with your staff and your HR files as well. They may have sort of an online portal or system that has a training matrix or any sort of way that you can log or keep your HR files electronically. They'll also be able to help provide documentation needed for sort of, let's say, CQC registrations, if you need to apply to the CQC, if you need to have a CQC registered managers interview, they'd be able to help with all of that as well. And then just general compliance after that. So at the end of the slide, I will give you more details about Compliance Company within our buying group. I'll go into more detail about that right at the end. Okay, so first of all, in terms of setting up compliance within your practice, now there are various folders that you can set up. So all of these can be set up in an actual hard copy folder, or if you wanted to set them up electronically as well, you can do. Now, this is an idea of some of the folders that you will need. So as you can see, there's various folders for various different things. So policy folder. Obviously, you need to have all of your policies set up in your practice. They all need to be relevant. They need to have personalisation to them, so information about your practice, your the staff members who are in charge of certain things or certain policies. So all of that needs to be reviewed. Of course, you've got your complaints and significant events folders, audits folders, GDPR, and so on. And we'll go through a few of these in more detail now, so you know how to set them up, what must be included within them, and how to maintain them as well. If we start off with audits and risk assessment, so audits. Now, there are various audits that can be done in your practice or need to be done in your practice. So what you need to be careful with is what's mandatory, what CQC actually look to be done, and also what sort of best practice. So, of course, there are audits that you can do for absolutely everything, but what I would say is at least be aware of what's mandatory, what's essential. So the essential audits that we'd be looking at would be, so let's start with your radiograph audit. This needs to be done every 6 months, and this is where you will obviously audit the radiographs taken in your practice by the associates and any radiograph qualified staff members as well, making sure that they are processing them correctly, make sure that they are putting things into their clinical notes, justification, grading, and so on. Clinical records keeping, so again, assessing the clinical notes, making sure consent is obtained, all of the things that need to be included in a patient's clinical file, ensuring that's all up to date, ensuring that the team are aware of what needs to go into clinical notes as well. And again, that is a 6-monthly audit. Infection control. So that is assessing the infection control measures put in place in your practice. And again, that's a 6-monthly audit as well. Generally with these 6-monthly audits, so I would advise to complete them every 6 months. However, if after a certain while you can see that the team are well on board, everybody knows what they're doing, and you're obtaining a good result, a good percentage every 6 months, then you could perhaps move that to a yearly audit, but most definitely start off with it every 6 months, especially if you're a brand new practice, you're starting up, you need to assess that more often. Your annual audit, so you've got your antibiotic prescribing audit, your DDA audit, which is your disability discrimination. So how is your practice set up? Are you accommodating for patients who may have disabilities? That would include sort of a ramp or a portable ramp. Have you got anything in place for patients who may be partially sighted or hard of hearing? So all of these things you need to take into consideration. And then lastly, your patient satisfaction surveys and audits. So you should be getting feedback from your patients continually, really, about their experiences at your practice, if they're satisfied, if they have any suggestions. And as you're sort of obtaining those reviews or satisfaction surveys, every year I would then audit those. So have a look at all of the findings, have a look at what your patients are saying about you, and are there any improvements that you can make in your practice. So that's pretty much with your audits. Now if we move on to risk assessments, and again, same thing, that there are many risk assessments that can be done, and there's no harm in doing sort of extra risk assessments, but it's important to know which ones are mandatory. So your first 2 main ones and 2 big ones in your practice are your fire risk assessment and your Legionella risk assessment as well. So these 2 risk assessments are ones that need to be done externally at least once, whether you open up your practice or sort of to begin with at first. Now, with these, we've put these down as 2 yearly audits. Now, what I would say is with both fire and Legionella, have an external risk assessment done. Have a look at the findings. So the risk assessors will issue you with a report. You need to read through the report. You need to have a look at any actions or recommendations, work through actioning those. Then have a look at how they have graded you. So have they scored you as a low risk, a medium risk, or a high risk practice? If you have been scored as a medium or a high risk practice, then I would get them out again 2 years later to see if you've made any improvements. If you are low risk, then as long as there have been no changes, no building or structural changes to your practice, and you're continuing with what they have recommended, so your schedule and your scheme as such, and if no issues are arising, then you can continue to risk assess your practice in-house on a yearly basis after that. And then you've got your other risk assessments, so that would be done annually, for example, with your Sharps risk assessment, health and safety, your dentist or staff risk assessment. And one that a lot of practices don't tend to think about is having a lone worker risk assessment. So if you have any staff that have no option but to work on their own, so it could be a hygienist or a therapist, for example, working without a nurse, you would need to do a risk assessment on them just to make sure that you have put all measures in place to protect that staff member, to protect the patient, and to minimise any issues or risks. So the next folder we Move on to is your health and safety in your COSH folder. Now, I would say prepare yourself. It's a very large folder to organise. There is a lot of work involved in this, but the good thing is once the bulk of the work has been done, it's very easy to maintain it after that. Delegate this out to staff members, get everybody involved. Everybody is responsible in your team to help with things like this. Now, what you've got to do is have a list of all the hazardous products, materials, items in your practice. And the easiest way to do this is to get in contact with your stock provider. They will issue you with a list of the stock that you order from them. And if any of those items come with a data safety sheet, that means it's a hazardous item and a COSH risk assessment needs to be done on that product. So once you have done a risk assessment on that, assess the item, it will go through things like what is the hazard associated with that product? Is there an inhalation hazard? Do you need to wear eye protection when handling that? And also having a look at access controls as well. So are you storing that hazardous item correctly? And so on. So once you've done all of these individual assessments for each item, and you've got them in place, that is your COSH folder then done. And the good thing after that is you just need to review it annually after that. Now, as the year is going by, what I would recommend is if you order or start to use any new product, just do a COSH risk assessment for it there and then, so it's done. If you stop using any products, just archive the risk assessment, the COSH sheet for that. And then once a year, all you've got to do is say, yep, COSH folder is up to date. We have a risk assessment for any new products and it just requires a signature. Okay. Consider having a separate area as well to store certain COSH items. So CQC will look to see that you have this in place. It could be a COSH cupboard. This may be somewhere where you store bleach, anything hazardous, just a safer area for it to be stored. Again, just to prevent any risks. Okay. Surgery and decontamination folders. So you've got to obviously make sure that you have checklists for both the surgeries and the decons for your startup and your close down. So this is usually something that the nurses would complete. So once they've set up the surgery for the day, they've got a checklist to work by. Have they set everything up? Have they put the filters in? Have they run their lines through? And again, for the close down as well. A lot of practices ask, how long do we need to keep these checklists for, and what we say is usually 2 to 3 years is enough. They can be logged on paper or electronically. There's no right or wrong as long as you've got the information. If CQC want to have a look at that, you've got that. It can be on the computer, it can be in a folder, it does not matter. And again, speak to your compliance consultant, reach out, get some advice and help on how to set up your surgeries. Have you got the correct posters in place? That could be hand washing posters, sharps, protocols. Make sure you've got signs that are displayed so you're clean and your dirty zones. Get that advice, reach out to your compliance company to make sure you're doing everything correctly and things are placed and situated where they need to be. So many times I've been to a practice and, a dirty sharps bin is placed on a clean side. And it's just making sure you've got the flow of the surgery and the decon correct as well. And as well, making sure that you've got all the right validation checks for your equipment. So your autoclaves, ultrasonics, washer disinfectors, whether you've got a non-bagged or a bagged type of cycle that you're using, you'll need to make sure you have your different validation checks. Again, all of this information is available on the internet or by your compliance provider as well. Servicing and maintenance. So this is a really important folder. Make sure you are up to date with your annual services or your biannual services. Now, the easiest way to do this is have a compliance calendar system. Again, this is something you can set up yourself. This is something that your compliance company can do for you, but some sort of reminder system in place, which is going to let you know when things are due for renewal when services need to be done. Make sure you're aware of the frequency. So, for example, your autoclaves would need to be serviced on an annual basis. You may be in contract with a service maintenance company that they may come out every 6 months, just depending on what that company's protocol is. But in terms of the mandatory requirement for your autoclave, it is on a yearly basis. Pat testing companies, for example, so a lot of companies will tell you that the pat testing needs to be done on a yearly basis, but there's actually no set requirement. There's no mandatory requirement for that to be done on a yearly basis. What CQC advise is every 2 to 3 years is sufficient. But again, just assess your practice. If there's been a year where you've got a lot more equipment that needs pat testing, you can bring it forward. But every 2 to 3 years, other than that, is fine. And as well, the important thing about knowing your frequencies is you can also save money in the long run. So you may be sort of getting your pat testing done every year, which can be quite expensive. Knowing the right frequencies will help you save money in the long term as well. Staff HR files. So these are very, very important folders, files, this whole HR setup. It's very crucial, and CQC are very hot on this. They expect you to have your staff folders, your HR files in order, everything up to date. And the easiest way to maintain this is to have some sort of checklist, an updated checklist, which lets you know everything that you need to have in place for each staff member. Or again, a compliance company that has some sort of portal or checklist for you to follow. What I tend to find in practices is that they have staff folders for their nurses, for their hygienists, and sometimes they don't think they need to have it for their dentists or associates. And 8 times out of 10, I find that the practice principal, who also works at the practice, doesn't have a HR file. Everybody working at your practice, employed or self-employed, needs to have a HR file. You need to make sure that you've done those checks. You need to make sure that you're recruiting staff members. You need to make sure that you're protecting your patients, your staff. So it's very, very crucial. So you need to know what is needed. So it ranges from, your proof of ID, your address, your Hep B vaccination. General immunisation is one that a lot of practices tend to miss out. Qualification certificates. Of course, you've got your vaccines as well. Another big one is DBS checks. Now, it's a huge grey area on this, and some practices don't know how often they need to be done, that they're not sure on the guidance. Now, there's no set requirement on how often DBS checks need to be done, but it's generally advised by CQC that it should be redone every 3 years for clinicians, hygienists and therapists included, and then 5 years for all your other staff members, so your nurses, your managers, any admin staff. You may have a big team, and to then monitor when everybody's 3 years or 5 years is up, it can take quite a lot of organisation and work. So what I would advise is the best thing to do is have a look, research up on the DBS annual update system. Really, really good thing to have in place in your practice for DBS checks. All you would need to do is each staff member, when you have applied for the new DBS, you've got, I believe, up to 28 days to apply for that annual update system, and that can be done on the DirectGov website. Now, what that means is within 28 days of you applying for the initial DBS, you pay £13 every year. It's a subscription. It just rolls on every year, and you've got a fresh new DBS check every year. The staff member will have an individual sort of portal login where they can manage their details. If they're working at 2 practices, they can update the information for both practices. So it's a really good system. And all you've then got to do is just risk assess and check that update system every year. If anybody is after a checklist, I can email that to you. Just get in touch. My contact details, email number will be I'll give that to you all at the end of these slides. Okay. MHRA, so your medical alert system. Now, with this one, you need to make sure you are subscribed to receive any medical alerts for dentistry. This can be done via the government website. So if you just type in MHRA dental alerts, it will talk through how you would subscribe to receive those alerts. Or again, that information can be provided to you by your compliance company. Make sure you are ticked. You've selected the box to receive dental alerts only. A lot of the time, practices are subscribed to receive alerts for care homes, GPs, and obviously that doesn't apply to you. So you're receiving lots of emails every day, and they're not very often that they come through for dental. So make sure you're subscribed to just receive dental alerts only. Then what you've got to do is review the alerts as they come through. So one, have a look if they are applicable to your practice. So do you have that project that's been recalled? Do you have that DBS with that particular serial number? If you do, of course, you've then got to action. So whatever the recommendations are on the alert, action those recommendations, order your new inhaler, or order your new defib, whatever the alert is. And then the most important thing after that is sharing that learning with your team. So in your next practice meeting, let your team know that this alert has come through. It was applicable to our practice. This is what we've done. I want to make you all aware. And that's all you need to do. Log that, put it in your folder, upload it on your online file. That's all you need to do at MHRA. And again, it's a folder where you need to have it in place, and not very many alerts come through, but when they do, that's how you would need to action it. If the alert is not applicable to your practice, then that's fine. You can just log that down as not applicable, but you've reviewed it, you've read it if need be. Okay. Some more useful information. So touching on practice meetings, now CQC advise to have a team meeting every 4 to 6 weeks. Again, with COVID, that was not possible. And in general, you know, we all get busy day-to-day sort of working life and practice, and it's not always possible to have a meeting every 4 to 6 weeks. If you do and they're pre-planned for the year, great. If they're not, then, you know, just try and have some sort of regular meeting with your team. Record all your minutes. So any communication that you have with your team, just log it all down. That could be WhatsApp group chats, it could be Teams meeting, it could be Zoom calls, whatever form of communication you are having, just jot it all down, because that is you having that communication with your team. You're sharing information, you're providing learning, so that can all go into your minutes for the meeting. One thing that CQC look at is to make sure that you've also logged who your non-attendees were, and then has there been a follow-up through after that. So if that staff member wasn't there that day, have you shared the minutes of the meeting with that team member to make sure absolutely everybody in your team is in the loop? Okay. And then lastly, you've got your complaints and significant events. So you need to have a folder in place for this. So first of all, with regards to complaints, make sure you know your protocol, make sure you know the timeframes. Is it sort of after 3 days of receiving a complaint, you need to acknowledge that? Is it 10 days or 14 days that you set up in your complaints protocol that you would aim to resolve the complaint? Make sure you're aware of that, make sure your team are aware of that, and they know what to do if they were to receive a complaint. You need to have a clear system to log everything. Again, I can, if you wanted to get in contact with me after this with regards to what type of system to have in place, what kind of logs that you need to have for your complaints, I can help you with that. And then also you need to assess complaints and instances. So if you were to have a complaint, if you were to have a significant event or an incident happen in your practice, as well as logging that, you need to then have a look at, right, what happened? Why did this happen? How, as a practice, are we going to prevent something like that happening again? And discuss that in your team in your next practice meeting. get all the team involved. You know, it could have been a slip, a trip, a fall of a patient, and you can sit down with the team and say, right, you know, how can we make our practice safer? What can we do? What can we put in place? Is it something that we let the patients know that, you know, please mind your step? Do we need to put some hazardous tape there? Things like that need to be discussed, and you need to have a look at ways of improving the practice, making sure something like that doesn't happen again. And again, logging all of that as well. Okay, so that's just a little bit of sort of advice on folders, what kind of folders you need to have in place, and what a few of the folders need to involve and include as well. Now, moving on to the CQC new strategy. So this came about in 2021. So CQC, they are changing how they regulate to improve care for everybody. The regulation, it will be more relevant to the way care is delivered and more flexible to manage risk in practice as well. But the purpose as a regulator won't change, but the way that they work will. So we'll have a look more into how they're going to change and what sort of ambitions they are proposing. So their key ambitions, there's 4 themes that they've highlighted. So the first one, people and communities. So what they've said is regulation that's driven by people's needs and experiences, focusing on what's important to people and communities when they assess, use and move between services. Now, looking into that more thorough, what they will be looking to do is getting more reviews, getting more feedback from people, listening more. They want to listen to a wider range of people, so maybe people whose voices are not heard. They'll be focusing more on that. Smarter regulation, so smarter, more dynamic and flexible regulation that provides up-to-date and high-quality information and ratings, easier ways of working with us, and a more proportionate response. So what they are proposing is, obviously, when they do come in to do an inspection, they are very focused on paperwork, looking at things, your folders, and what they want to do is less paperwork, more talking to patients and staff, having a look at the culture of the practice, and having that ongoing conversation with practices, with owners, rather than just coming in for an inspection every 3 or 5 or more years. So they want to have a better relationship with practices, seeing how they can actually support and help you, rather than just coming in for that inspection and then not visiting again for numerous years. The third theme, safety through learning. So regulating for stronger safety cultures across health and care, prioritising learning and improvement, and collaborating to value everybody's perspectives. So they want to have a look at the workplace culture. They want to have a look at and then speak to the staff. You know, are they happy? What's the culture of the practice like? Making staff feel that they can be open and honest, and that CQC are approachable. And if improvement is needed, they want to act more quickly with that as well. And then lastly, accelerating improvement. So enabling health and care services and local systems to access support to help improve the quality of care where it's needed the most. So what they want to do, so obviously CQC can come in, they can inspect your practice, they can tell you what to do. How they want to work more closely with practice owners and practices in general is highlight improvements that are needed, but then also offer a range of resources. So giving you the option to, okay, this is what we need to improve on. These are the resources that are available to us, and you then identifying what way will work best for you in the practice to make those improvements. Okay, so just a little bit the new strategies for CQC. And for any information, everything is available on the CQC website, so that is the link there. Again, anybody who wants copies, a copy of this slide afterwards, just get in touch and I can send that to you. But like I said, everything is available on the CQC website, so you can read more about the strategies in more detail. So, how can we help you? So Samara have put together a buying group. So it's a Samara Alliance Buying Group. And essentially what we are doing is helping independent dentists like yourselves to gain access to the very best prices in the dental market so you can achieve your best possible margins. So that's our website there. Have a look at the Samara website, at the Alliance website. What we are doing is we are going to be helping you save money, give you exclusive benefits on various services. So that could be consumables, it could be your equipment, utilities, dental software, and one of the big ones that I want to talk about today is CQC compliance. So we have partnered up with various companies. You can join our buying group and have access to exclusive benefits with these companies, and of course one being our compliance company, which we are working with and we are very pleased to be in partnership with, is DCME, so that's Dental Compliance Made Easier. Now, with Dental Compliance Made Easier, they are a compliance advisory service. They have a portal system. They can set up your compliance for you. They can do mock inspections. They can get you CQC ready, inspection ready, and maintain your compliance after that. Now, to get access to an exclusive benefit and discounts to their service, all you need to do is get in contact with us and join our buying group. Now, our buying group manager, my colleague Gurpreet, I've popped his number and email address below. Feel free to get in touch with him for any information. You can also set up a virtual free consultation meeting with him using Calendly, and that's the link for Gurpreet at the bottom as well. Again, I can send this slide to anybody to get in touch at the end. Okay. So hopefully that's sort of gone through a few tips on compliance and what you need to put in place, a little bit about the folders, the strategies, and how we can help you as well. So get in touch. That's my email address, my contact number, and our website as well. If you are looking to set up compliance in your practice, whether you are a brand new squat, whether you are an existing practice, joining the buying group, it can benefit you in many ways. You can save discounts, save money on various services, and obviously compliance being one of them. So yes, feel free to get in touch. Any questions, don't hesitate to email me. I hope you have enjoyed the webinar today, and we look forward to hearing from you soon.